Hello, guys, and welcome to episode 5, Tonic Clonic Seizures. This is the second episode where we have the generalized seizure group. Let's begin. So, we will start off with background information, then causes, then symptoms, and then we'll end it off at avoidance and answer, and then key takeaway for this episode. So, when most people hear the word seizure, this is one they picture, okay? The dramatic one, the movie scene, the one where everybody is afraid of. That's the tonic-clonic seizure. A tonic-clonic seizure is a generalized seizure, meaning it doesn't just start in one small area of the brain, it involves both hemispheres at once. When this happens, consciousness is lost immediately. There's no warning conversation, no awareness, no memory of what's happening. The brain essentially pulls the plug and reboots. The name actually tells you what exactly is happening. Tonic means stiffening, clonic means rhythmic jerking. So yes, this seizure has two very distinct phases, and both are caused by massive, uncontrolled electrical activity flooding the brain. And just to clear something up right now, tonic-clonic seizures are not rare, not contagious, and not a sign someone is possessed or dangerous. They're a medical emergency only when they last too long, but they are also a neurological condition, not a character flaw. So now what causes tonic-clonic seizures? There isn't just one answer. Some people are born with a genetic form of epilepsy that makes their entire brain more excitable. Others develop tonic-clonic seizures after brain injuries, infections, strokes, or tumors. They can also happen during drug or alcohol withdrawal, especially if someone suddenly stops after heavy usage. And in people with epilepsy, tonic-clonic seizures can occur if medications are missed, even once. So now let's talk triggers, because this is where the prevention really matters. So common triggers include sleep deprivation, intense stress, illness or fever, flashing lights, dehydration, and yes, alcohol. Basically, if your brain is exhausted, overstimulated, or chemically unbalanced, or it's more likely to lose control. Think of the brain like a power grid. If demand spikes, if demand spikes too fast and there aren't enough safeguards in place, everything goes dark. So tonic-clonic seizures usually begin suddenly. Sometimes there is a brief warning called an aura, especially if the seizure starts as a focal and then it spreads. But often there's no warning at all. The tonic phase comes first. The body stiffens completely, the person loses consciousness, and may let out a cry, not because they're in pain, because air is forced out of their lungs as muscles contract. Breathing may briefly stop, and the person may turn slightly blue. This is terrifying to watch, but it's temporary. But then now comes the second phase, clonic phase. This is where this is when rhythmic jerking begins, arms, legs, and sometimes the whole body. The jaw might clench, saliva may foam, and loss of bladder control can happen. None of this is intentional and none of it is within the person's control. The seizure itself lasts 1 to 3 minutes, but afterward comes the postictal phase. And this part is often overlooked. The person may be confused, exhausted, emotional, sore, or having a pounding headache. Some sleep for hours, some wake up embarrassed, scared, and confused about where they are. And here's the key point. During the seizure, the person feels nothing. They're not aware. The suffering comes after, not during the seizure. Now, preventing a tonic-clonic seizure relies heavily on consistency. Taking medication exactly as prescribed is crucial. One missed dose can be enough to trigger a seizure in some people. Lifestyle also matters. Regular sleep, hydration, stress management, and avoiding known triggers can significantly reduce risk. Some people also use some people also use seizure tracking apps or wearable devices to spot patterns. For example, Seizure Care is a seizure tracking app that you can use in this case. In more severe cases, surgeries or in more severe cases, surgeries, there's something called a VNS. I believe it's called vagus nerve stimulation, or specialized diets like the ketogenic diet may be used. Now, this part is critical. What should you do if someone has a tonic-clonic seizure? So first, stay calm. Panic helps no one. Gently lower them to the ground if possible. Clear the area of hard or sharp objects. Cushion their head. Turn them onto their side to keep the airway clear. Do not put anything in their mouth. They will not swallow the they will not swallow their tongue. That's a myth, and it's a dangerous myth. Time the seizure. If it lasts longer than 5 minutes, or if another seizure starts without recovery in between, call emergency services immediately. That's called status epilepticus, I believe, epilepticus, and it's a true medical emergency. When the seizure ends, stay with them. Speak calmly, let them rest. Do not bombard them with questions, just tell them that they're safe. Finally, the key takeaway. I'll just summarize this. So, tonic-clonic seizures are intense, dramatic, and scary, but they're also treatable, manageable, and misunderstood. The more people know what's happening, the less fear there is. And knowledge in this case can literally save lives. And that is the end of episode 5, Tonic-Clonic Seizures. Thank you and have a nice day.